Hey, we're here today with Dr. Nguyen, orthopedic surgeon for Emergent Orthopaedic and Reconstructive Surgery. And we're going to talk a little bit about MIS and IT and how it's important. How do you use information systems in your field?
We use it essentially now for everything. It's currently almost getting to be where it's a mandatory requirement that we use it. The Joint Commissions request that the federal government requests that we have electronic medical records, and we use it basically for our entire management of our business.
Okay. How much does your company value MIS?
Well, I mean, to give you an example, when our information services goes down, like if our server goes down, we're actually unable to run a clinic without it. And so that's essentially how valuable it is to us. It runs the front office portion, it runs the back office portion. It's extremely valuable.
Oh. How much has MIS improved your company?
We started with MIS before, so I mean, we started the company setting up a medical information billing service, medical record service. So I don't exactly know what we would have done without it, but you know, I remember when we used to have to chart paperwork, and it was just an enormous amount of paperwork that we would have to have on hand. It really eliminates your need for about 40% of your office space to store paperwork and process paperwork. So that's actually, you know, probably one of the most valuable things we have.
Has it weakened your company in any way?
Weakened? No, it hasn't weakened it at all. If anything else, it's, you know, made it more efficient and stronger.
Okay. Has the benefits of implementing an IT system outweighed the costs?
The PR, the public relations behind people who sell these things, is it takes around 2 years to recoup the costs. But it's very hard to determine those costs because, you know, the manpower involved in not using IT services that are currently available are significant. So I would tell you that, you know, within a year's time, I was very happy with, you know, what we had as far as system-wise to, you know, do our billing, to process our claims, to keep our electronic medical records and keep them all in sync.
Okay. How has MIS changed your business processes?
I think our billing services have gotten much smoother since that's done. We used to do paper billing, and then we'd have to send it off. We'd have to keep track of those, each individual one. With a good program that manages your billing, these alerts come up to you, you know, fairly regularly the way you set it up to be. So, in that sense, it has streamlined our system and made it more routine and easy to do.
Does it make it easier for your patients to get information as well?
Yeah, absolutely. I mean, as far as electronic medical records is concerned, you know, once they request a medical records, we don't need a person to go to a photocopy machine, photocopy all the relevant medical records, and give it to the patient. We just actually print it out and then give it to the patient.
How was implementing? Let me rephrase that. Has implementing MIS systems, did it pose any challenges in initial?
Yeah, I mean, because every medical practice is customized towards, you know, the kind of patients they see, what they do. So in choosing the right system is, you know, critical in my mind. So the challenges is to make it, to utilize all the technology that's available. One, to reduce your overhead and costs, and two, to streamline your ability to see patients in a fast, effective way. And so there's different systems, but the system I chose was flexible, so then getting it so that it fit my practice was the major hurdle.
How would your job be different without MIS today?
I think it's just the amount of paperwork involved in seeing patients, you know, making sure that, you know, the charts are available when you see the patients. That requires, usually in a high volume practice, hiring someone just to, if you didn't have electronic medical records, you'd have to pull the charts available and ready to see for that day. And so it can vary from 40 to 60 charts per day that, you know, that person would have to pull and make sure the records are there. Right now, it's just a matter of we don't usually see any notes printed out on paper unless we absolutely have to, and at that point then we just use mainly the computer system, so that it speeds the flow of your patient. So as reimbursement rate goes lower, we're always trying to figure out ways to speed the flow of our patients, without hampering their care or quality.
I know you're on call at 2 different hospitals in 2 different areas. Can you give an example of how MIS can help implement patient records and billing processes between those hospitals?
What our office does is it pulls those patients that are seen, creates an automatic file for them. We then enter all their account information into our computer systems before the patient's actually ever seen. So we piggyback off the hospital MIS system to get that information, and then once most of that information is entered, they have a chart available and ready to use, and all that remains to be done is clinical notes at that point.
Are there any negative aspects to MIS?
Yeah, the upkeep of the MIS system is, still, I think you still have an upkeep, so you're replacing someone who would normally pull charts for you, you replace it with, someone who maintains your computer systems for you. And then to update your, like I said, to utilize the entire technological spectrum of the MIS system, you actually have to have someone build and customize all the stuff that's available within that system to meet your needs. So there's always, there's always some cost per month involved in using an MIS system.
Do you believe you can compete in your field today without MIS?
It would be very hard. I mean, I could compete. I think it's just competition is a matter of clinical skills. I think that what it does is it reduces my costs to compete, where my cost can be 35 to 40% of my gross revenue. It could rapidly increase to 70% of my gross revenue were I not to use MIS systems.
Okay. Where do you see MIS or IT in the future, and how will it affect your field in particular?
A little bit of it is, the government, what they decide to do with the MIS system, but I think that, from my standpoint, we are rapidly approaching an area where we're going to have dictation streamlined with the hospitals, so that everything is in continuity. The essential aspect of it, which is basically to eliminate paperwork and to speed up the billing process.
Do you think, I know we had this conversation the other day about the voice command. Do you think the dictations, for example, for people that don't know, it's the dictation of notes, clarify notes, do you think people will be obsolete in the long run?
There will always be people who want to dictate, and because it's a personal issue. I think that when you look at the vast majority of your patients, some of them don't need dictations because they follow a certain pattern of healing process, certain pattern of disease processes. And to minimize your costs, what we would do is we would do voice activated dictation, or we would do templates, where we just have to change the side or the duration of the disease, and they follow the same disease pattern. That reduces your overhead quite significantly. As far as voice activated dictation, I think it's still a long ways, because you can still speak quite quicker than what the normal voice activated dictation can do for you.
Okay. How do you believe MIS has impacted the society we live in today as a whole?
I think we're tied together significantly now, more so than ever. Information is so much more readily accessible.